Now comes the big question. How do you tackle acne, or rather, how do you tackle acne? So let's hear the expert advice of Dr. Teo, as well as Xinlin here is going to share some beauty tips with us. First big question. Natural ingredients or chemical ingredients? So many people have this misconception that, products with natural ingredients are good or products with chemical ingredients are not so good. So when it comes to choosing skincare products to tackle acne, is this really a case of either or? What do you think, Dr. Teo?
That's a great question, Bex. Now, as to whether natural or chemical ingredients are preferred in a skincare formulation, the answer is to focus on whether the active ingredient itself is evidence-based. Some examples of naturally derived ingredients that are beneficial come in the form of potent plant-based antioxidants, while chemical ingredients that are beneficial include salicylic acid, benzoyl peroxide, retinols, and retinoids. Now, while these are all synthetic chemical structures, they have been proven in studies to have beneficial effects on acne.
So we know that whether it's natural ingredients or chemical ingredients, nature and science can actually work concurrently together to offer the best of both worlds to our skin. So then now, right, what are some of the ingredients that we can look out for when it comes to acne care?
Absolutely, Bex. So specific ingredients that can address inflammation are plant-derived antioxidants. In particular, Centella asiatica, also known as Sika or the Indian pennywort, has been well established to be a potent antioxidant, meaning that it reduces inflammation and promotes good healing of scars. Ingredients like those derived from avocado oil, these are rich in structures known as polyphenols and fatty acids such as oleic acid. These can certainly help in inflammation as well as in the healing of acne scars. In terms of treating excess oil production, some ingredients are particularly effective at reducing the activity of the oil glands. Salicylic acid, for instance, can have a good effect in terms of reducing oiliness of skin.
So many people have this misconception that cleansers should leave your skin not just clean but squeaky clean. But of course, it's not wrong to want to cleanse your skin deeply, but it's not ideal when your cleanser leaves your skin feeling, dry and tight, right, Dr. Teo?
You're absolutely right, Bex. So the function of a cleanser is to remove dirt, oil, and grime that's left on your skin at the end of the day. And the importance of this is really to maintain a healthy bacterial load, also known as the skin microbiome. However, in individuals with skin conditions such as acne, there is an imbalance in the bacterial load, and cleansing them becomes particularly important part of the skin routine. Now, if the cleanser is too harsh on the skin, you're going to aggravate these conditions because it dries the skin out. In terms of maintaining the skin barrier, this is not ideal. On the other hand, if there is ineffective cleansing, it becomes a breeding ground for bacteria. Hence, the ideal cleanser is one that can effectively remove the oil, dirt, grime residue on your skin, while at the same time preserving a layer of moisture. So specifically, as you said, Bex, if your cleanser is leaving a squeaky tight feel on your skin, it's a sign that it's far too drying, and it may not even address your concern of having oily skin and may paradoxically lead to excess oil production, a condition known as reactive seborrhea.
Okay, so I know that the Acne's creamy wash, it contains amino acid as its base, which is said to leave your skin feeling soft and supple after cleansing without the feeling of like tautness. So Dr. Teo, what is this amino acid?
Now, the amino acid surfactants are distinct from traditional sulfate-based cleansers in the sense that it has a much lower pH. Now, traditional sulfate-based cleansers, the high pH environment of the cleanser leads to increased abrasiveness and dehydration of the skin, which over time reduces the skin's ability to fight infections environment as opposed to alkaline surfactants, which means that the skin is not disrupted and hence is better protected against the environmental allergens and pollutants.
Spot treatment or skin treatment? So Xinlin, are you only targeting your problem spot, problem skin as a whole? So actually, right, should adopting a full routine then be recommended, Dr. Teo?
That's a fantastic question, Bex. Now, in terms of a skincare routine, I would position it as a beneficial lifestyle choice, akin to, say, having a healthy diet or a regular exercise regime. The reason is because the skin is an organ that's very accessible, which means that whatever topicals you apply on it, it can be absorbed and consequently affect the physiological function of skin. So in terms of a good skincare routine, I will whittle it down to the following. A good gentle cleanser, we've spoken about it in the previous part of this conversation. A moisturizer that is comfortable on oily skin, especially in a humid climate like Singapore. I would recommend serums, lotions over cream formulations, which tend to be rather uncomfortable and occlusive for skin. Acne spot treatment, as well as a sunblock, sun protection is really important for reducing the hyperpigmentation associated with acne scars. Now, zooming in a little bit on what Xinlin spoke about for spot treatment, I just want to share some of my tips. Now, traditionally, a lot of people put acne creams only where the acne develops, but there is another way of using these acne creams as well, and it includes applying a thin layer of this acne cream over the area where you're acne prone, and it can be over the chin, your T-zone, the cheeks, and over time, this can help to reduce the formation of microcomedones due to the active ingredients present in the spot cream. However, in terms of the specific spot treatment of your pimple, do follow the manufacturer's recommendations because certain ingredients contain astringents that can be very drying, dehydrating. So if you apply that more often than is indicated, you could find yourself developing a condition known as irritant contact dermatitis.
So, you know, many people with acne-prone skin or oily skin, they tend to skip the moisturizer because they think that, you know, that their oily skin doesn't need more hydration. Or they think that moisturizers can only make things worse. But that isn't really the case, right, Dr. Teo?
Yes, Bex. So the topic of moisturizing in acne is very important, and skipping moisturizers, even if you have oily skin, is definitely a myth. The reason is because even when your skin is oily or greasy, it may lack the lipid barrier that protects your skin from the external environmental factors. This is very common in individuals who describe their skin, as Xinlin did, as being oily as well as dehydrated. Now, if you have oily skin and decide that you're going to skip a moisturizer and just use an astringent dehydrating cleanser or toner, you may find that you have a paradoxical reaction, and this is known as reactive seborrhea. So this is when your oil glands are trying to overcompensate for what it feels as a defect in the skin's lipid barrier because of over-cleansing as well as the use of astringent agents. So if you do have oily skin, the key thing though is to choose a moisturizer in the correct formulation. So one that is cosmetically acceptable for somebody with greasy skin would likely be an emulsion, or lotion, or serum formula as opposed to a cream formula.
So we have another question from a viewer. So how to prevent, this is from YJCHW. Okay, how do you prevent acne from reappearing on the same spot? Could you answer this for us, Dr. Teo?
Absolutely. So now if you do notice that you have acne that keeps coming up over the same spot, the truth is you may actually have something a little bit deeper than what you see, which is otherwise known as an acne cyst. Now the times when you find that the acne cyst gets a bit smaller or when you think it's almost gone is when the cyst reduces. But why we call it a cyst is because there's really a wall that's lining the surroundings of the collection of pus, dead skin, and other material that's causing the bump. Now, when it gets inflamed, and that's when you notice that it reappears again. Now, another way to look at this condition is if you're prone to getting acne over the entire T-zone area for a lot of adult women with hormonally related acne, you tend to get it over the U-zone, which is the jawline, the chin area, then it may be helpful to use a prescription retinoid that can overall reduce the formation of microcomedones in that area.
So let's jump right into our final question. Letting your acne breathe, yes or no? Doctor, can you enlighten us, please?
Bex, this is actually quite a paradox because, on one hand, we know that occlusion acne can occur with comedogenic substances and more recently, acne. And on the other hand, we consider a moist healing environment as beneficial for the healing of inflammation. So, a simple way to think about it is this: if you do not have inflamed acne, then it is important for your skin to have some sort of breathability in terms of moisture wicking, comfort levels, and also because the presence and retention of heat and sweat can become a bacteria breeding ground and subsequently lead to flare-ups in acne. However, if you have already an inflamed acne bump, sometimes creating a moist wound healing environment can help to reduce the inflammation. An example of that would be the use of hydrocolloid patches, the acne patches that can be applied over inflamed acne papules. These are an example of how moist environment can actually help the healing of acne.
So aside from letting your acne breathe, right, popping out acne, yes or no?
Well, I think you know the answer to this, Bex. Popping a pimple is always a bad idea because it can get even more inflamed and you're going to use your fingers to touch your skin and that can introduce bacterial infections. What I suggest is this, and we've all experienced this in our lives. So if you can see that the pimple is coming to a head after a warm shower, gently use a moist cotton pad and press around the acne pustule or the papule until the contents are expressed. However, if this is not successful, certainly don't use pressure to try to remove the bump because that's going to cause even more inflammation and scarring.
I have a final question from a viewer. This is from Eliza0515. What is the best type of fabric to prevent acne? So I would think breathability plays a role in this, right, doctor?
Well, in terms of the best type of fabric to prevent mass acne, it actually seems like an easy question for me to answer, but it's truly rather complex. So the categories of fabrics can be broadly divided into, firstly, the natural fibers. So we're familiar with cotton, linen, silk, as well as synthetic fibers, such as polyester. Now, polyester is typically the material that is used in our medical grade personal protective equipment. Now, the difference in reusable fabric mask worn by the public and is currently recommended and medical grade PPE is this. For the general public, we are recommending widespread reusable fabric mask wearing as a matter of social responsibility to prevent contamination of our environment with our biofluids. So our biofluids refer to our respiratory droplets as well as our saliva. For example, when we speak, because COVID has been demonstrated to transmit via both droplet and aerosols. Now, in terms of this function, you have to take into consideration the fact that synthetic fibers are going to be waterproof and far more effective in terms of achieving the aim that the public health recommendation sets out to do. Whereas, the natural fibers, they may seem to be more breathable in terms of layperson understanding. These perform very poorly in terms of protecting your environment from your respiratory droplets. Now, what I'm currently recommending my patients, and is my area of research, is the concept of biofunctional textiles. So these are typically synthetic, very durable textiles that have been treated to make them skin-friendly and have certain antimicrobial, antibacterial benefits that can reduce the incidence of mask acne.